we are going to discuss health-related issues of consumers. Consumers nowadays are more cautious about the health care system in India. In India, only some sections of people are getting free reimbursement of medical expenses because government pays on their behalf. Healthcare in India is now in private hands. As a result, there is mushroom growth of corporate hospitals, and the cost of Medicare has become abnormally high. Added to it, every doctor is now prescribing some diagnostic tests in the name of defensive medicine. But ultimately, the victim is consumer. It is necessary for those consumers who cannot afford to pay these high bills of Medicare, they need to go for insurance. Medical insurance is becoming popular day by day, and the insurance companies will have their own terms and conditions. If consumer agrees to those conditions and prepared to pay the premium, though it is high, then a medical insurance would be given. There are age limitations. No insurance company can refuse to give medical insurance policy up to 65 years. Suppose if a consumer takes insurance policy at the age of 63 or 64 and gets his policy renewed without any break. After attaining 65, the insurer should not say that as your age is more than 65, we don't renew. So, in already existing policy, if it is properly renewed every time without any break, they need to continue that medical insurance to that particular policy holder lifelong. They cannot refuse to renew. These are all certain aspects that the Insurance Regulatory Development Authority prescribed. So, what is the necessity of a consumer to read out totally the terms and conditions that are incorporated in the insurance agreement? They should realize, because all the rules and regulations, the clauses, they are all in small fonts, and nobody is really interested to look into those. The insurance policy will be given only after you sign the agreement, and the agreement is unilaterally drafted. You cannot remove one condition to suit your requirements. Strictly speaking, that is not an agreement at all. Between two persons knowing each other, the conditions incorporated therein. But these insurance agreements are drafted, printed, and supplied to the consumer only for the signature, whether he likes some of the conditions or not. So be careful. Understand what are the reasons for denial of a claim, why your insurance claim is repudiated. These are the matters that create a lot of headache when you are going to claim for hospital expenditure. The first thing which they show is pre-existing disease. If the insurance company knows that you have this disease 48 months before the policy is given, then they may refuse to give you the claim stating that you have a pre-existing disease which you have not informed to us. You have concealed. You have not disclosed. This is one reason generally the Mediclaims are rejected. Second thing, nowadays they are practicing the insurance claims through a third-party administrator, and they reject the claim simply because the third party administrator has not accepted it. It is also not correct legally. So very recently, Supreme Court has given a directive that the insurance claim can be rejected on proper grounds, not as per the opinion of the third party administrator. These are certain things that create a lot of problems for the insured in claiming the amounts of hospital bills. And nowadays we also find much publicity on cashless hospitalization. Cashless hospitalization means the insurer would give an undertaking to the hospital that the insured's bills would be paid by them. He need not take any money for payment to the hospital, because the other side is insurance company which has promised to pay the entire treatment costs. These are the three aspects the insured should remember, and insurer cannot deny the claim without any reason. They will have to disclose the reason basing on which this particular claim is rejected. Insured should submit all the documents that are required to process the claim. They set some 30 days or 60 days time to submit the papers. Within that time, they will have to submit. If there is any genuine reason, even if the papers are submitted after 60 days, they will be accepted. In case of delay of payment of claim by the insurer should pay interest also more than bank rate of interest by 2%. If banks are giving interest at 5%, they will have to give 7%. If banks are giving at 7%, they will have to give 9% for the delay caused in settling the claim. Generally, the claims should be settled within 30 days and the payment should be given. Any delay in payment would attract this interest. With this, let us close this topic today. We come up with some other topic in the next episode. Thank you.
For more videos, please subscribe to our GoraViniyogi channel presented by Dr. Samaram Multi-Channel Network, which has more than 18 crore views, and click the bell icon for notification of our new videos.
Please download Samaram Multi-Channel app and watch your favorite channels from your mobile. App available on Google Play Store and subscribe to the channels.